fossa, we did popliteal fossa already. So what you should know is, we should know the boundaries, what are the structures, their relations. Yes, you correlate with popliteal fossa, whatever we studied in that way, we should know cubital fossa also. We will see brachial artery and also the anastomosis around elbow joint. So cubital fossa is a triangular space which is present right in front of the elbow joint. Okay, so it is serving as an entrance to the forearm. That means from this whole area, from the shoulder to elbow, you call it as arm. From the elbow to the wrist, you call it as forearm, isn't it? Then, so cubital fossa, see boundaries are, see base is this plane, what you have, like this is an imaginary line between medial and lateral epicondyles of the humerus. Okay, so laterally this muscle you have brachioradialis. This whole is brachioradialis and this is the medial border of brachioradialis. That means this side is the medial side of the picture and this side is the lateral side of the picture. And medially you are finding lateral border of pronator teres. This is pronator teres muscle. This becomes medial border, this becomes lateral border. Hence lateral border of pronator teres is one of the medial boundary of cubital fossa. Apex is the meeting point, right? Brachioradialis and pronator teres meeting point is the like apex. Now coming to the roof, so we have certain, you can see, you can look at your own cubital fossa. So what do we have there? We have skin, we have superficial fascia, there we have cephalic vein, then lateral cutaneous nerve of the forearm this side, then medial cutaneous nerve of the forearm. Okay, then connecting the cephalic and basilic vein, we have median cubital vein. So we have deep fascia also, we have bicipital aponeurosis. Okay, whatever contents you are seeing here, you are supposed to practice this and put it in your own words. It's all again a game of your memory. You need to revise, repeat, then only you can remember. Okay, then so cubital fossa, so the contents are, you have to remember, there is a code but a very easy to remember, MBBR. MBBS is also like you are doing MBBS course. Similarly there is a code which is MBBR or MBBS. What, let us, like, let me just elaborate these words. M is standing for median nerve. Okay, B is standing for brachial artery. We know brachial artery is a continuation of axillary artery. And here in the brachial artery will divide in the cubital fossa into two branches, terminal branches. Towards the ulnar side, medial side, it is ulnar artery. Towards the radial side, that is lateral side, it is radial artery. Okay, then MB over. One more B is, like we have bicipital aponeurosis, which is cut over here, not shown. Okay, below which you have biceps brachii tendon. Okay, bicipital aponeurosis, below which you have biceps brachii tendon, and R is deep branch of radial nerve. Okay, deep branch of radial nerve. Okay, is not actually, we see superficial branch of radial nerve beta. That's the reason you can use the word MBBS. Okay, MBBS is the code. Okay, from lateral, medial to lateral side. I'm repeating once again. See here, M median nerve, B is brachial artery, another B is biceps brachii tendon, and R is superficial branch of radial nerve. So these are the contents of cubital fossa. Medial to lateral side, this is the list: median nerve, brachial artery, tendon of biceps brachii, radial nerve, superficial branch. The medial cubital vein is actually connecting the cephalic and basilic vein, which will be seen as the roof. Now, when you talk about median nerve, it is passing downwards, forwards between the ulnar and humeral head of pronator teres muscle. So this is the pronator teres muscle. Here it is running. Okay, and it gives a branch to that muscle. Then brachial artery is this. So it is central in position, medial to this tendon, biceps brachii tendon, opposite to the neck of the radius. This brachial artery is dividing into two terminal branches. What are those? Radial and ulnar arteries. Okay, so the tendon of biceps brachii, basically it gets inserted into this point. This is radial tuberosity. Okay, so here actually you will have a bursa in order to lubricate. I told you biceps brachii is the strong supinator. So we do so many actions which are involving supination only, isn't it? So in order to give lot of lubrication to this muscle, here at the radial tuberosity, we have a bursa also. Okay. So this point is biceps brachii insertion, and here from the biceps brachii insertion, you are finding there is an like extension of aponeurotic sheet, which is called as bicipital aponeurosis. Okay, then. So what is the fourth content? I said radial nerve. A short course of radial nerve is seen in the cubital fossa, medial nerve, brachial artery, biceps brachii, tendon, and last one is radial nerve. Actually, this is running between the brachioradialis, this muscle, and brachialis. This is our brachioradialis and this is brachialis. Between these two, radial nerve is running, and you can see it is actually dividing into two branches. The one which is running below brachioradialis is the superficial branch, okay, and the one, just a minute. So now you can see this is the deep branch which goes deep to the supinator muscle, and the superficial branch runs just below brachioradialis. Okay, then so deep branch and superficial branch, both the branch. I told you this is the supinator muscle. The deep branch is actually running between the two heads of the supinator. Okay. Then the superficial branch runs just below brachioradialis and then it becomes cutaneous. So all these points will come again when we do radial nerve as a separate essay question. Okay. Suppose if any essay is repeated, we will take radial nerve in place of that. Okay. So radial nerve is finally becoming cutaneous. That superficial branch, no, actually it becomes cutaneous, like that is the posterior cutaneous nerve of forearm. Okay. Then the floor of cubital fossa, we have two muscles in the floor. What are the muscles in floor of popliteal fossa? Popliteal surface of the femur and popliteus there. Here we have brachialis and supinator muscles. Okay. So medially you will see brachialis and laterally you will see supinator. Medial and lateral. Okay. Medial and lateral. Then, once you are done with cubital fossa, brachial artery may come as a 4 marks question. So, let us see the details. So, axillary arteries continuation is brachial artery. Brachial artery at the neck of the radius will divide into two terminal branches, that is radial and ulnar arteries. Okay. Now, see here, this is subclavian artery continuing as axillary artery continuing as brachial artery. At the neck of the radius, this is the neck of the radius. The brachial artery is dividing into radial and ulnar arteries. Okay. So now coming to the brachial artery relations, what is the name of this muscle? Biceps brachii. So anteriorly, it is actually covered by this biceps brachii muscle. Upper part is coracobrachialis. Okay. Then you are also finding the other nerves, like it is also covered by medial cutaneous nerve of the forearm, which is actually lying in front of it. Middle part of it is crossed by this nerve. What is the name of this nerve? From the lateral cord and medial cord of the brachial plexus, you will see there is one nerve which is formed, that is median nerve. Initially, if you observe median nerve, it is related lateral to the brachial artery. But you can see as you come down, median nerve is crossing and it is becoming medial to the brachial artery. In the cubital fossa, median nerve is medial, brachial artery is lateral. So this part is medial part of the diagram. This part is away from midline. It is lateral part of the diagram. Okay. So like that it is. So it is shown here. This is our brachial artery laterally, initially median nerve, which later becomes medial to the artery. The other relations are medial cutaneous nerve of arm and forearm, which are seen on the medial side of brachial artery. Medial side of brachial artery. Okay, if you remove this brachial artery, posteriorly it will be related to triceps muscle, long head and medial head of triceps, coracobrachialis and brachialis muscles. Okay, so brachial artery relations at this point, if you check, medially it is related to ulnar nerve. I tried using 3 different arrows to emphasize which is which structure. This is ulnar nerve. Okay, so lower down you are seeing basilic vein. Okay, and lower down This is median nerve in cubital fossa, MBBR, that structures. Okay. So laterally, the brachial artery is related to, in upper part is related to median nerve. This coracobrachialis is this muscle, biceps brachii is this muscle. Lower part, this artery is related to tendon of biceps brachii. Okay, that is. Now coming to the branches of brachial artery, we have muscular branches, we have nutrient artery, profunda brachiae artery, superior ulnar collateral, inferior ulnar collateral. Okay. Now see here, this is brachial artery, continuation of axillary. The extent is from the lower border of teres major to the neck of the radius. The whole thing is brachial artery. See the branches? Like for femoral artery, I gave you the name profunda femoris. For brachial artery, we have profunda brachiae. Okay, then listen to the branches carefully, because these branches will now come when we do anastomosis around elbow joint. Okay, so we have superior ulnar collateral artery, we have inferior ulnar collateral artery, which are direct branches coming from brachial. But from profunda brachiae, we have the branches like radial collateral artery. Okay, so which is also called as posterior descending branch. We have middle collateral artery, which is also called as anterior descending branch. So 1, 2, 3, 4, these four arteries, no, they take part now in the anastomosis around elbow joint. So be clear, superior ulnar and inferior ulnar are the direct branches coming from brachial, whereas radial collateral and middle collateral, these are the branches coming from which artery? Profunda brachiae. Profunda brachiae. From the profunda brachiae, the other branches are, you have like a deltoid branch which is ascending upwards. Okay. What are the terminal branches of brachial? Last branches, radial artery towards the radial bone, lateral side, ulnar artery towards the ulnar bone, that is medial side. Okay. Now, if you understand this picture, you have understood everything in fact. Now, see here, I told you this is the medial epicondyle of the humerus. This is the lateral epicondyle of the humerus. This is ulnar bone, medial side, radius bone, lateral side. Now, if you observe the anastomosis in front of the medial epicondyle, this is medial epicondyle. You are finding inferior ulnar collateral artery is anastomosing with anterior ulnar recurrent artery. See here, just to take the picture of this slide if you are not screen recording. This, with the help of this, you will write everything. See, this inferior ulnar collateral in front of the medial epicondyle is anastomosing with anterior ulnar recurrent, which in turn is a branch of common interosseous artery. That means, I told you this whole thing is ulnar artery. You can simply write ulnar artery also. From the ulnar artery, you have this always arteries which go back, you use the word recurrent branches, isn't it? So we have anterior ulnar recurrent, posterior ulnar recurrent is going behind the medial epicondyle. It comes an anastomosis with superior ulnar collateral. Superior ulnar collateral is a branch of brachial artery which goes behind the medial epicondyle, and it anastomoses with the posterior ulnar recurrent artery. Now, coming to the lateral epicondyle of the humerus, in front, this artery. This is radial collateral, anterior descending branch, one more name. Radial collateral is anastomosing with radial recurrent artery. Okay, radial collateral is anastomosing with radial recurrent artery. And middle collateral is anastomosing with interosseous recurrent artery. Interosseous recurrent artery, which is again a branch from coming from common interosseous artery. Common interosseous artery is a branch coming from ulnar artery. Ulnar artery is giving one common interosseous branch. We know between radius and ulnar we have interosseous membrane. In front of the interosseous membrane we have anterior interosseous artery. Behind the interosseous membrane we have posterior interosseous artery. Okay, so this interosseous recurrent is actually coming from posterior interosseous, and it goes and anastomoses with middle collateral artery. Okay, read carefully this picture, practice this picture, You write the answer in your own words. This is anastomosis around elbow joint. Okay. So theoretically, so much is written. It sounds boring also. Okay. So if you just understand the concepts, you will write in your own words. If you want, I will repeat again. See here, in front of the medial epicondyle, we have inferior ulnar collateral anastomosing with anterior ulnar recurrent. Behind the medial epicondyle of humerus, we have superior ulnar collateral anastomosing with posterior ulnar recurrent. Then, in front of the lateral epicondyle, we have radial collateral anastomosing with radial recurrent. Behind the lateral epicondyle, we have middle collateral anastomosing with interosseous recurrent. If you write these four names also enough. Front 2, behind 2, front 2, behind 2. Okay, 4 plus 4, 8 names. If you write, you will get full marks after you draw this diagram. Okay, like that, actually we have covered the essay answer. Cubital fossa, brachial artery, 5 marks. Then anastomosis around elbow joint, another 5 marks. So 10 plus 5 plus 5. No, for you 15 marks. No, cubital fossa can come as a 15 marks. So like that, 3 topics have been covered in this lecture better. Okay, so brachial pulse or cubital fossa. Obviously, brachial artery is here, so we can check the brachial artery for pulsation. We can also use it to record the blood pressure. Suppose if it is rupturing at this point, generally you may see there may be ischemia. Ischemia is non-availability of blood supply to a particular area. Like it may lead to contractures of muscles due to non-availability of blood supply, which is called as Volkmann's ischemic contracture. Severe trauma to the elbow or forearm may result in the damage of brachial artery, which may lead to contracture like this, because the long flexor tendons and extensor tendons will not receive blood supply. Okay, because artery is damaged. Okay, one more 3 marks question is being covered here now, beta. Median cubital vein. So median cubital vein is basically connecting the cephalic and basilic vein. Cephalic vein is seen on lateral side, thumb is lateral, little finger is medial. So connecting the cephalic and basilic vein, see this is our cephalic vein, this is our basilic vein, here you have median cubital vein. Okay, this is median cubital vein. So most prominent superficial vein which is seen just in front of the elbow joint. Okay, so we can choose this vein for intravenous injections and also for drawing blood. Okay, hope you understood this. So many questions of short notes whichever are not done here, so are replaced by many more other questions, isn't it? So that is lumbricals you study because we have discussed cardiac muscle. I'll show you. Fertilization development of palate we will do with embryology. Branches of axillary artery. I've shared one picture also in our group. First part, one artery, thoracoacromial. Second part, superior thoracic, lateral thoracic. Third part, 3 branches, subscapular, anterior circumflex humeral, posterior circumflex humeral. Okay, so dorsal venous arch of hand is a venous arch which you see on the dorsum of our hand. Medially it continues as basilic vein, laterally it continues as cephalic vein. So on the dorsum of hand, whatever arch we see, that is the dorsal venous arch. It will be receiving venous channels from the digital veins and metacarpal veins will be draining into it. Very small topic beta. Nuclei of cerebellum also I told you, giving the codes D, E, F, G when I was discussing physiology cerebellum. So we have dentate nucleus, emboliform nucleus, nucleus fastigious and nucleus globosus. These are the 4 nuclei. This also I told you, middle meatal opening. What do we see? We see maxillary air sinus, frontal air sinus, anterior and middle ethmoidal air sinus, isn't it? And actions of superior oblique muscle of the eyeball. Recently, we have finished the orbit chapter. Okay, so I am stopping here and within 5 minutes, I will send the link for biochemistry. Be ready.